Lieutenant Owen
Gitme.
Fletcher's last
Lütfen
clear
beni
memory
bırakma.
before the darkness was the cargo bay depressurization alarm screaming through the transport vessel, the sickening lurch as explosive decompression tore through their hull, and the horrifying realization that his safety tether had failed. The rest was fragmentary, tumbling through vacuum, desperate gasps as his suit's emergency oxygen struggled to compensate, the cold that seeped through supposedly insulated layers, and then nothing. Medical data would tell him later he'd been clinically dead for 4 minutes and 17 seconds before the Sythrani rescue team retrieved his body, that his core temperature had dropped to levels incompatible with human survival, that the explosive decompression had caused internal injuries that should have killed him. But Owen didn't know any of that when he first regained consciousness. What he knew was pain, comprehensive, overwhelming pain that suggested his body was very angry about still being alive. And through the pain, something unexpected, the sound of someone crying. Owen's eyes wouldn't cooperate initially, his vision fragmented and unreliable. But he could hear, ragged breathing, the kind of quiet sobbing that suggested someone trying desperately not to be heard, and occasional words in Sythrani that his translation implant rendered imperfectly. Please, tried everything, don't know if enough, please work. The voice was female, young-sounding, carrying the kind of desperate hope that came from watching someone die despite every intervention. Owen forced his eyes to focus, his vision gradually resolving from blur into actual shapes. He was in what looked like a medical bay, Sythrani design based on the organic architecture and bioluminescent lighting. Equipment he didn't recognize surrounded his bed, and beside him, hunched over his bedside with her face buried in her hands, was a Sythrani woman. Her skin was the distinctive iridescent blue-green of her species, her elongated features streaked with tears, her shoulders shaking with quiet sobs she was clearly trying to suppress. Owen tried to speak, but his voice failed completely. He managed a small sound, something between a groan and a whisper, that was barely audible. The Sythrani woman's head snapped up, her large amber eyes widening with shock as she registered that he was conscious. For 3 seconds, neither of them moved. Then she was on her feet, reaching for medical controls, her hands shaking as she activated monitoring systems. "You're awake," she said in Sythrani, her translation implant rendering it in English. "You're actually awake. I need to, medical staff needs to know, but you're awake." Tears were still streaming down her face, but now they seemed to be relief rather than grief. "Don't try to talk. Your throat was damaged by the vacuum exposure. Just stay still. Let me get the trauma team." She moved toward a communication panel, but Owen managed another sound that stopped her. She turned back, her expression mixing professional concern with something more personal, genuine emotional investment that seemed strange for what should have been routine medical treatment. "You need medical assessment," she said, but her voice carried uncertainty, like she was torn between following protocol and staying with him. Owen tried to communicate through expression what his voice couldn't manage, that he understood, that he was okay with her getting help, but also that he was confused about why she was crying. She seemed to understand at least part of that because her hand moved unconsciously to her face, wiping at tears she clearly hadn't realized were still flowing. "I'm sorry," she said quietly. "This isn't professional, I worked on you for 6 hours trying to restart your cardiovascular systems, and I didn't think." She stopped, clearly struggling. "I'll get the senior medical team. They need to verify that your revival is stable." The senior Sythrani medical team arrived within minutes, swarming Owen's bedside with professional efficiency that contrasted sharply with the young woman's obvious emotional distress. They conducted examinations, adjusted equipment, consulted in rapid Sythrani. The young Sythrani woman Owen learned her name was Lyrae when the senior physician addressed her, stood at the edge of the medical activity, her professional composure mostly restored but her eyes still showing evidence of tears. "Lieutenant Fletcher, I'm senior physician Korath." the lead medical officer said in heavily accented English. You've experienced catastrophic injuries from vacuum exposure and explosive decompression. The fact that you're conscious is unexpected. Medical Specialist Lyrae has been managing your treatment for the past 18 hours. She'll continue monitoring your recovery. 18 hours. Owen managed, his voice barely functional. You were clinically dead when our rescue team retrieved you. Medical Specialist Lyrae spent 6 hours performing resuscitation protocols that exceeded standard treatment parameters. You've been unconscious for the subsequent 12 hours while your body attempted to recover from injuries that should have been fatal. Korath's expression was professionally neutral, but something in his tone suggested disapproval of whatever exceeded standard treatment parameters meant. The medical team departed after completing their examination. Lyrae remained, ostensibly to fulfill monitoring duties, but Owen noticed the way she positioned herself, not at the medical station where monitoring would be most efficient, but beside his bed where she could see his face directly. "You're wondering why I was crying," Lyrae said after a long silence. "It wasn't professional. Senior physician Korath has already reprimanded me for emotional involvement in patient treatment. But when you opened your eyes, I couldn't." She stopped, clearly struggling. Owen gestured slightly, the best he could manage, indicating she should continue. "You were dead," Lyrae said quietly. "Genuinely dead when the rescue team brought you in. Protocol says we attempt standard resuscitation for 6 minutes before declaring casualties irretrievable. I went 18 minutes. Used techniques that aren't approved for treating non-Sythrani physiology because I couldn't accept that you were gone." "Why?" Owen managed. "I don't know. I'm supposed to maintain professional detachment. We treat casualties from multiple species. It's standard procedure to remain objective. But something about watching you die, knowing you'd survive the initial decompression only to die in our medical bay, Lyrae looked at him directly, her amber eyes still showing moisture. "I couldn't let it end that way. So I kept trying interventions, kept pushing beyond protocols, kept believing that if I just found the right treatment combination, I could restart your systems." "You saved my life," Owen said, "by refusing to give up." "I violated treatment protocols and exceeded my authority to continue resuscitation efforts," Lyrae corrected, but without real conviction. "Senior physician Korath has documented this for review. I may face disciplinary action for using unapproved techniques on human physiology. But I'm alive." "But you're alive," Lyrae agreed, something that might have been a smile crossing her features despite the tears that had started flowing again. "And I know I should maintain professional distance, should be objective about your recovery, should treat this as successful medical intervention rather than personal investment. But when you opened your eyes, and I realized the 18 minutes of refusing to give up had actually worked." "You cried," Owen finished. "I cried. Because for 18 hours I've been watching your vital signs, terrified that the techniques I used might have damaged something we couldn't detect, worried that you'd never wake up, carrying the weight of having exceeded every protocol and not knowing if it would be worth the risk." Lyrae wiped at her eyes again. "This isn't how Sythrani medical professionals are supposed to behave." "Maybe not," Owen said, his voice getting slightly stronger. "But it's how someone who genuinely cares about their patient's survival behaves. That matters more than protocol." Over the following days, as Owen's condition gradually stabilized, he learned more about exactly what Lyrae had done to save him, and why it had affected her so profoundly. The 18 minutes of resuscitation had involved techniques from 3 different medical traditions: Sythrani, advanced cellular regeneration; human cardiovascular support systems that Lyrae had studied but never actually used; and experimental treatments she'd essentially improvised based on theoretical xenobiology. "You took an enormous risk," Owen said during one conversation. "If any of those treatments had interacted poorly, you could have caused irreversible damage." "I was very aware of that possibility," Lyrae admitted. Every additional minute I continued treatment, I was calculating the odds that I was doing more harm than good. But the alternative was accepting your death, and I couldn't. She paused. I couldn't let that be the outcome. Why did it matter so much? Owen asked. You didn't know me. I was just another casualty. Professional detachment is reasonable. It should have been professional detachment, Lyrae agreed. But when the rescue team brought you in and I saw your injuries, saw how young you were, saw that you'd survived the initial decompression only to be dying on our medical table. She struggled with the explanation. It felt personal in ways I can't fully articulate. That's not failure, that's compassion, Owen observed. Maybe, but compassion that exceeds treatment protocols and risks patient outcomes for emotional rather than medical reasons is dangerous. Senior Physician Korath was right to reprimand me. Senior Physician Korath wasn't watching you die, Owen said quietly. He didn't spend 18 minutes refusing to accept that outcome. You did, and I'm alive because of that choice. You're alive because experimental treatments happen to work despite every reasonable medical calculation suggesting they shouldn't, Lyrae corrected. That's not skill, that's luck. It's both. Luck that the treatments worked, skill that you knew which treatments to attempt, and compassion that you cared enough to try them despite the risks. Owen managed to shift position slightly. When I first woke up and saw you crying, I didn't understand what it meant. Now I do. Those weren't just tears of relief. They were tears about what you'd risk to make that survival possible. I cried because for 18 hours I've been terrified that I'd damaged you in ways we couldn't detect, Lyrae said honestly. That the revival would fail, or that you'd wake up with cognitive impairment, or that the experimental treatments would cause delayed complications. And when I opened my eyes and was clearly conscious, I cried harder because the relief was overwhelming and I couldn't maintain professional composure anymore. Lyrae's expression was vulnerable, which Senior Physician Korath correctly identified as inappropriate emotional involvement. Maybe it's inappropriate by Sythrani medical standards, Owen said. But from my perspective, knowing that someone cared enough to cry when I survived, that matters more than any protocol. Owen's physical recovery continued over the following weeks, but the emotional impact of understanding exactly what Lyrae had done created a bond between them that transcended typical patient-physician relationships. Senior Physician Korath approved my continued monitoring of your case, Lyrae mentioned during one visit, with the caveat that I maintain appropriate professional boundaries. He's concerned about the precedent set by my treatment decisions. Would you, Owen asked, make the same choices again if faced with similar circumstances? Lyrae considered seriously. Rationally, I should say no. I should acknowledge that exceeding protocols was dangerous. But honestly, if I was faced with another patient dying despite standard interventions, knowing I had theoretical knowledge of experimental treatments, she paused, I'd probably make the same choices again. Or it suggests you understand that protocols are guidelines, not absolute limits, Owen offered. As Owen's recovery reached the point where he could be transferred back to human medical facilities, Lyrae made a final visit. You'll be departing tomorrow, she said, her professional composure mostly intact but something vulnerable showing through. Human medical staff will handle your continued treatment. Your prognosis is good. Full recovery is expected within 6 months. Thanks to 18 minutes of refusing to give up, Owen said. They stood in silence, both aware this was probably the last time they'd see each other. When I first woke up and saw you crying, Owen said, I didn't understand what it meant. I thought maybe you were upset about the casualties from the accident. I didn't realize you were crying because you'd spent 18 hours terrified that your decision to exceed protocols had been a terrible mistake. And now that you understand, now I understand that being saved isn't just about medical intervention. It's about someone caring enough to take risks they shouldn't take, to push beyond what's reasonable, to invest emotionally in an outcome they can't guarantee. You didn't just restart my cardiovascular system. You refused to let me die when every protocol said you should stop trying. That's a very generous interpretation of protocol violations, Lyrae observed, but something in her expression suggested she was moved. It's an accurate interpretation of what you did and why it mattered, Owen said. You cried when I opened my eyes because you'd invested everything in my survival without knowing if it would work. Those tears meant something. They meant my life mattered enough to you that risking your professional standing was preferable to giving up. Later, after Lyrae had departed and Owen was preparing for transfer, he thought about what it meant to be saved. He'd been critically wounded, hovering on the edge of death. He'd opened his eyes to see an alien woman in tears, tears that revealed depth of care that transcended professional protocol. Lyrae had saved his life. But more than that, she'd shown him what it meant to be valued as a person rather than just a patient, to have someone